That was truly thought-provoking. Let us now hear another voice that will further highlight the power of science and unity in shaping a healthier world. Our next participant is Tauseef Ahmed from Rieu School and College, Karachi. Tauseef, please proceed.
आ गया हूँ ये रहा नीचे 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 थोड़ा मुंह नीचे ठीक
Excellencies, distinguished professors, and my fellow delegates. Imagine for a moment that we all are architects. But instead of designing skyscrapers of glass and steel, we are tasked to build the most complex structure of the known universe, a healthy human life. For centuries, this construction was left to a chance. But today, we possess a blueprint that allows us to peer into the microscopic dance of a virus and edit the very code of our DNA. CRISPR gene editing process, AI-generated Shutterstock. They say magic is in the science we don't understand yet. For decades, a child born with a single-cell disease faced a lifetime of pain. To the world of our parents, curing this was a dream. To us, in 2026, it is a documented reality. As noted by the World Health Organization, we have entered in the era of precision. Just last year, we have witnessed the first CRISPR-edited gene therapy for a single cell gain global momentum, effectively rewriting the genetic destiny. Furthermore, biotechnology has brought us lenacapavir, a ear-twice-yearly injection that offers nearly 100% efficacy in HIV prevention. This figure, 99.9%, is a testament that what happened when we refuse to let a virus outpace through our intellect. Honorable judges, this spirit of innovation is thriving right here in Pakistan. We stand on the shoulders of Professor Zulfikar Bhutto, whose pioneer research at Aga Khan University has influenced over 5,300 policy documents, saving the lives of countless peoples through just simple science-backed intervention. Just this year, our 52 of our own Pakistani scientists were ranked among the top 2% of the world-class influential researchers. These are not just statistics. They're proof that even with limited resources, our talent can redefine the global medicine. My dear friends, the theme of this conference, Together for Health, stand with science. Science is not a solitary pursuit. It is a relay race. According to the NCBI, we are currently hosting 59.56 trillion bases of genetic data. If this data were kept under the lock and key, progress would stall. When we say together, we call for multilateralism. When we say multilateralism, we're calling for one health approach. As recently has Pakistan strengthened through the 2025 Pandemic Fund grant to reinforce the animal and human health surveillance. We must move beyond the siloed science, because when we share data, we don't share just numbers, we share hope. To the experts in this hall, we thank you for guarding the integrity of this peer process. To my fellow delegates, our role is to be an ambassador of evidence. In a world where digital myths spread faster than the medicine, we must be ones who ask, what is the source? We must have to champion a world where a health of an Indus River seen as vital as the health of the children who play beside it. As we conclude, I ask you to not look at challenges for today, but look for the possibilities of tomorrow. Let us leave Karachi with a renewed covenant to not be swayed by the tides of observation, opinion, but anchored by the bedrock of observation. For the sake of our future, for the honor of our nation, and for the sake of truth, let us stand with science. Thank you so much.
Thank you, Tauseef, for your inspiring ideas and clear message.